Hi, everyone. Thank you for joining us. We're just letting people come in at the moment, but I am going to start with our general land acknowledgement. We would like to begin by acknowledging the Indigenous peoples of all the lands that we are on today. While we meet today on a virtual platform, we would like to take a moment to acknowledge the importance of the lands which we each call home. We do this to reaffirm our commitment and responsibility in improving relationships between nations and to improve our own understanding of local Indigenous peoples and their cultures. From coast to coast to coast, we acknowledge that ancestral and unceded territory of all the Inuit, Métis, and First Nations people that call this land home. Please join us in a moment of reflection to acknowledge the harms, mistakes, and ongoing consequences, and consider how we are and can each in our own way try to move forward in a spirit of reconciliation and collaboration. You're welcome to share your location in the chat. My name is Kelsey. I am one of your moderators for this session. I am currently living in Ottawa and I'm working towards my PhD in rehabilitation science. I bring a lens of lived experience living with cerebral palsy. I have been an NYAC member since March 2023, and I'll pass it over to our other moderator, Jacob.
Hi, my name is Jacob. My pronouns are he, him. I have been an NYAC member since 2023, January 2023 specifically, but have been working with Childbright since 2020. I have epilepsy, autism, ADHD without H, low frequency hearing loss, and dyslexia. I am from the Greater Montreal area and West Island, and I have lived in Quebec for most of my life. Welcome to this webinar.
Thanks, Jacob. As an introduction to this webinar, we'll introduce you a little bit to Childbright, the NYAC, and the goals of this session. So Childbright is a Canadian research network that's been working since 2016 to support kids and youth with brain-based developmental disabilities and their families. It brings together around 500 people, including scientists, doctors, parents, and leaders, to figure out how to help earlier healthcare, improve healthcare, and make services better. Our mission is to ensure that people who've lived through and are living through these experiences are part of the research and to turn what we learn into real changes in school, healthcare, and communities. We care about fairness, inclusion, and making sure the work actually helps the people in everyday life. Regarding the NYAC, since 2018, the National Youth Advocacy Council has advised Childbright projects and other child and youth health projects in youth engagement. Made up of 10 to 12 Canadian youth with lived and living experiences of brain-based developmental disabilities, such as cerebral palsy, autism spectrum disorder, ADHD, and genetic conditions, among many more, NYAC members provide input throughout each part of research, from shaping questions to sharing results. We help with study design, recruitment, communication, and knowledge sharing, and sharing our perspectives are essential to the work. For tonight's session, we're hoping that you'll learn the following: to share the skills we have learned, like navigating power dynamics, leadership, collaboration, advocacy, and critical thinking, and how we use them in school, at our jobs, and in our ongoing advocacy work. We also want to open the floor for a chance for you to ask questions about what you can learn from being in a youth advocacy or advisory council and ask any questions you may have. I will now pass it over to Jacob to introduce our great line of panelists for tonight's session.
I'm now going to introduce our panel members and start with our first question. Please join me in welcoming Matthias Castaldo, a youth facilitator and family support specialist at Holland Bloorview Kids Rehabilitation Hospital, Logan Wan, a inclusion, diversity, equity, accessibility, and anti-racism IDEAA professional research assistant / coordinator, health policy analyst, and a registered social worker, and Claire Da McCord, a medical resident at Dalhousie University. Thank you for joining us all today. For my first question, can you please share your experiences with Childbright and how these experiences have influenced other parts of your life? Would you like to start us off, Logan?
I muted. Okay. So currently I am one of the chair people of the YAC of the NYAC with Ciara, and I've been with the council since its inception in 2018, and I've been one of the chairs for about 3 years now.
Hi everyone, my name's Claire. I've been with the NYAC since 2020, and as Jacob said, I'm currently doing my residency in emergency medicine at Dalhousie University. But when I joined NYAC, I was still in my undergrad at McMaster, and was involved specifically with the Ready or Not Brain-Based Disabilities RCT that was being supervised for me by Dr. Jan Willem Gorder and Dr. Nguyen. And as part of that, I was also one of the Child Bright Summer Studentship awardees. So I did a summer studentship with them and then also had my undergraduate thesis supervised by Child Bright. So I have been around here for quite some time. It's been definitely super empowering to get involved in research as a youth, and then specifically being able to carry those skills forward into medical school and now into my medical practice has been really helpful.
Hi everyone, my name is Matthias. So I had joined Child Bright in NYAC in around kind of 2018. Previously kind of like, and I joined kind of when I was still cleaning up my undergraduate degree. I completed an undergraduate degree in psychology at Toronto Metropolitan University, and then I was later fortunate enough to complete a Master's of Education in psychology over at the Ontario Institute of Studies and Education, which is OIC, which is part of U of T. And NYAC and Chaba kind of really kind of helped enable me in terms of like my academic and also my professional careers. As now I kind of work as a facilitator and family support specialist at Holland Delivery Kids Rehabilitation Hospital. But when I joined kind of the NYAC and Child Bright, it was kind of really, really empowering for me just because like I was able to connect with kind of some other youth and people that also had disabilities like myself, and that connection and observing kind of just how the members kind of succeeded in their academic and their professional careers, like really kind of helped me, gave me the courage really to seek out kind of new academic and employment experiences. And through NYAC, that really enabled me to kind of participate in some research and get some research experience. And I was able to, fortunate enough to get to be a part of what was known as a CU project, which was led by Dr. Sakehu Yamaguchi and Dr. Linda Nugent. And they provided me kind of like a lot of kind of great kind of research skills. And also through Child Bright, I had the opportunity to do a lot of kind of different kind of speaking engagements, such as presenting at conferences, which really kind of helped me develop some of my communication skills.
Thank you for sharing. We'll now go a little deeper into these experiences. What are some of the skills that you learned or are still learning with Child Bright that have been the most valuable to your professional career? Would you like to start us off this time, Claire?
Sure. I think as I mentioned, having done my summer studentship project with Child Bright, I had not really had any specific research experience before then. So being with such a trusting organization and one that not only was willing to pay me as a youth researcher, which is really hard to have happen sometimes, but also were so supportive in making sure that, I had all the resources available to me, that I was treated as an equal member when I was going into these projects was really fantastic. It helped me from, becoming a young researcher, making sure that I had those skills. We had weekly sessions on kind of how to approach your research that were led by Pierre, who was actually also on this call, which was super helpful for me as someone who hadn't really had those hard skills developed through a master's or PhD program. Um, and then specifically to my project that I did during the summer studentship, it was a policy project, which was something that was a little bit new to me. I had been involved in multiple policy projects, more so from like a youth advisory perspective, but this was my first time as a researcher being involved in one. So kind of being able to learn how to do semi-structured interviews and a narrative analysis on the text that we were having was a really great research skill to learn in terms of more qualitative versus quantitative research. And also during that time, I was able to have some collaborations through the Ready or Not trial with different projects around the world. And I've had a couple of publications as a result of that. And Dr. Nguyen's very hand-in-hand guidance. She is truly one of the best people at Childbirth. I think she's like helped me every single step of the way. So it's really been super beneficial. And I think that also from, like a personal confidence and public speaking perspective, it's been really great to kind of grow alongside Childbright, from being 18 to, now being a medical resident and having these opportunities come up frequently and being comfortable in my own skin to say, yes, I do want to be involved. And yes, I have the ability to kind of speak up and advocate for myself to be there.
And for me, I really echo what Claire has been saying about growing alongside Childbright. Since I was part of it, since the youth council's inception, I didn't start out as a chairperson, but they've allowed me to grow my leadership skills in terms of my own confidence in leading this group of young leaders, and also like using some of the transferable skills that I gained through this experience, like um, being able to talk in large groups, or just from basic things like um, being able to talk about myself in a way that's both talking about my personal and professional experience, and also um, how that has now transferred into my paying job at McMaster, where I am a research associate, and and some of the language or the terms that we use on the council to talk about research and to intertwine our lived experience. I very much use that on a daily basis in my job, and for that I'm really grateful.
So like for me, like when I joined kind of Childbright and NYAC, like I obviously kind of wanted to have an impact and like utilize and share my lived experience of kind of growing up and living with cerebral palsy as well as a learning disability. But some of the other things that I really wanted to learn was I really kind of wanted to advance some of my academic and my research skills. And NYAC and Childbike really kind of provided me with that opportunity because there's always kind of opportunities to kind of join in on projects. So, for example, when I was a member of NYAC, I had the opportunity to be a patient partner on a project called the CU Project, which was, as I mentioned before, led by Dr. Sakeki Yamaguchi and Dr. Linda Nugent. And this was a study that kind of looked at and kind of some of the experiences of youth with disabilities who have partnered with research. So we were kind of we were interviewing some of these participants and some of these youth. So when I kind of joined the project, I was very, very apprehensive because I didn't have a whole lot of research skills or research experience under my belt. So I was a little bit nervous now, and I was kind of thinking like, oh, I don't know if I'm gonna be able to, perform well, and I was quite nervous. However, the research leads kind of really provided kind of really great mentorship for me. And they really kind of encouraged me to, develop some of my skills and providing me different opportunities to participate in research, which was such an empowering experience. So, for example, I was able to I got to participate and help out and do some of the interviews of the participants, which was so cool and really empowering. And I learned how to how to ask the questions, how to help build a rapport, and I was able to kind of utilize my lived experience to build a rapport with the participants, which helped yield some more information from them. And in addition to that, I learned also how to do data analysis and code with qualitative data, which I've never done before, which was really kind of really interesting for me. And in addition to that, they also provided me with opportunities to, design the poster for the conference, which was something, again, like I'd never done. So I was given kind of all these opportunities to do something new. And they provided me with such support that like I felt a lot more confident going into coming out of this project. And it had such kind of and being able to participate in this project had such a positive kind of experience on my personal life and both like my academic and just overall skills. Like sharing my lived experience kind of taught me how to speak a little bit better about my both growing up and living with a disability and how to utilize it in the context of research. And in addition, like being a part of this project, as I already mentioned, like I was able to develop so many relevant research skills that I hadn't had the opportunity before. And in addition to that, like being part of NYAC really also provided me opportunities to do a lot of different speaking engagements. Like I got to speak at conferences about the project, about the CE project, and as well as attend other conferences as well and speak at webinars, which again kind of really helped develop some of my communication skills, which then I can apply to other areas in my life, such as my job at Holland Bloorview, and as well as kind of just developing some of those other soft skills that are so important in our careers.
Challenges when advising and research are inevitable. How did being on the NYAC prepare you to face these challenges and to be more prepared for future opportunities? Would you like to start us off this time, Matthias?
Sure. Thanks, Jacob. So for me, like for instance, in my job, I work in a primarily in a non-clinical role, right? So often, like a lot of the what the clinicians say, like often their recommendations or what they say kind of holds a little bit more weight in terms of kind of like goal setting and kind of the clinical kind of aspect of that. However, like having said that, like ENIAC and Childbright really taught me how to use my lived experience with a disability as a strength and how to utilize it in various kind of projects and as well as kind of with clinical judgments. So, for example, if a clinician kind of shares something about a client, I might kind of also share my own perspective because I also have a disability. And I can share, well, maybe the client's feeling like this because of this situation, or maybe this is how the disability is affecting them based on my own experience, right? So that kind of adds a little bit of opportunities in terms of like advocacy and learning how to utilize my own experience. And so, and in addition to that, like I mentioned before, ENIAC really kind of helped me develop a lot of my research skills that I hadn't really had the opportunity to develop in the past. And as I mentioned before, I was quite nervous kind of getting involved and working with researchers because I didn't have that research experience, and that kind of creates a bit of like a power imbalance. However, as I mentioned before, like the research leads kind of provided me kind of with those opportunities to develop kind of those research skills. And after having kind of that experience of being a part of that project and getting to kind of have those opportunities for the research leads to essentially mentor me, now when I kind of go into a different project, like I feel a lot more confident kind of like advocating and sharing like, hey, like I don't think the direction this project is necessarily kind of working out because of this, because I've had this previous research experience and I've had this experience of learning how to communicate and talk about my lived experience. But also like I learned kind of how to advocate kind of for others, right? And how, say, for example, like how maybe like a project is having an impact on, say, like a youth partner, right? Or how to advocate about representation for disability, or how to really kind of utilize a person's experience and advocate kind of for the recommendations that they're making, even if they don't necessarily have like a clinical degree or necessarily are a lead researcher. Should we pass it over maybe to Claire?
Yeah, sounds good. I would say that was very well put, Matthias. I think that one of the biggest challenges in general with youth advocacy and research is, having those youth advocates being considered an equal player at the table. And, having been the youth advocate that is being involved in research, and then also having been a researcher having youth advocates on the panel, I have seen both sides of it. And I think that was a very eye-opening thing for me, because I was always like, well, why didn't you involve us from day one? And then I had to go through my first REB proposal and I was like, oh my God, No, I know. There's a lot here and it can be very overwhelming. So I think, having Child Bright support me through that timeline of learning all of those steps and getting to know just how complicated it is to become a researcher and, making sure that I am involving people with lived experience from day one is definitely super interesting. Um, I think that it's also made me more aware of ensuring that there are minority and underrepresented voices, and that can often include those who just have lived experiences are brought to the table in all of the different projects I've been involved in, research or not. And then I think also, in my own practice as a physician, it's changed how I approach my patients. I try to approach my patients much in the same way that I would people who I have involved in the research project, where I really try to make sure that they are at an equal footing to me in terms of their decision making, and making sure that I lay things out in a way that is appropriate, and kind of trying to bring them into the care team just like I would if this was a research project. And I had youth advisors coming into that as well.
Yeah, I totally agree, Claire. I think the most challenging thing about being a youth in this space is um, the the power dynamics between the researcher and the youth, and how we have to work 10 times harder to be believed and listened to and heard. And I think Child Bright is a great example of allowing youth to learn those self-advocacy skills within that space, and also making sure that the researchers really do value our voices. Um, so much so that those skills have transferred onto my current job at McMaster, where I'm now leading a team where I have a youth and a child advocate or and child partner, and that comes with its own challenges because it's my first time involving a child in research. But I really value the experiences that I've had, and I can now, the tables have turned. I can impart that onto some of the youth and the children that I have on my own research teams now.
Thank you for continuing to share your experiences. Now, before opening up to the audience for questions, I have one last question. What would you say to anyone interested in being connected to a youth advisory or advocacy group? What do you think, Logan?
I think I would say that um, it really depends on which organization that you want to engage with, but I think that um, regardless, it's a great opportunity to build those research skills and also build the self-advocacy skills and the understanding of yourself as someone with lived experience, how to communicate that to other people, specifically people who are non-disabled, and how to use that within a research context to advance research that is about and for people with disabilities and or lived experience.
You could have said it better, Logan. Yeah, I kind of like echo Logan what you kind of already said. My what I would kind of say is like really kind of like seek out those opportunities. I know for me personally, like I learned like so much like academically, and personally, like academically, like I learned so much about kind of like research, how to what's involved in research, and also how to read research and summarize it. And also kind of like personally, like I learned like how to communicate a lot more effectively and feel a lot more comfortable communicating with researchers, and people that have like really kind of amazing titles with them. And there's also there's like opportunities like to network, right? So for instance, like I got to meet kind of other people that quote unquote are like me that also have a disability, and it's been so kind of empowering to see them succeed and hear their stories, because it's definitely provided me with the courage to seek out some other academic and professional experiences. And also like there's opportunities like for mentorship. So for instance, like when I was being part of like the project, CE project, like the research leads kind of essentially mentored me on research methodology and how to develop those skills, which again like really kind of empowered me. And there's also those opportunities for professional development, right? So for example, being able to present at a conference like that's an opportunity for me to again develop my communication skills and also learn about some of the research that's done by other researchers. The when you being able to kind of join, like one can really kind of have an impact, not only on oneself, on kind of your own professional development and personal development, but also like have an impact on say for example research on different projects that are happening in Canada, for example, and really kind of have a meaningful impact on the projects that you are a part of.
Yeah, I think this is the kind of a question that comes up regularly for me because mentorship is something that I'm really big on. And I think, kind of as I age out of the youth category and more into, um, young professional category of my life, I think that that's one thing I've really tried to focus on. And the biggest piece of advice that I tell people is to make sure that they ask for opportunities. That kind of applies to anything in your life, but specifically in terms of youth-oriented research, there are lots of organizations who are out there who want to work with youth. And I think that it's such a special pool of people, that really making sure that you find the right person to ask those questions to, and having someone kind of in your back pocket as your, I'm really scared to go to this conference. What do I do? Like that person on speed dial to call is really, really helpful. And I think that, just making sure that those youth feel empowered, that they are an equal member at the table and they deserve to be treated as such. And making sure that they're in an organization that will support them in doing that, like this one.
Thanks so much, Matthias, Claire, and Logan. I will now pass it to the audience. If there are any questions, please feel free to put your questions in the chat, or please raise your hand if you want to ask a question directly. We would also love to hear from you if you have your own experience that you want to share. So we have a question from Ibrahim. I hope I'm pronouncing this right. I apologize if I am not. They're asking, what advice would you give to early career researchers who conduct youth-oriented research and want to engage with youth? How should they approach the first contact so that they don't come across as pushy? I would appreciate it if you could share a bit about how you were first approached. Thanks again.
I'm happy to take that question. Great question, Ibrahim. And I think like as someone who has done their own research and has also been on the other side of it, it was something I was also worried about. I would say my most positive experiences have been with researchers who are willing to kind of meet me more as a person first. So kind of starting with like an informal conversation, getting a coffee, having a Zoom call, making sure that you are getting to know them as a person before you're bringing them into what could potentially be a many years long project with them, is super helpful. And I think kind of speaking to them the way that you would someone who you were friends with, but still in a more professional context would be how I would do it. And I think kind of tailoring that approach to exactly what kind of demographic you're hoping to recruit. This is obviously different if you're trying to work with much younger youth, like if we're talking like a 14 to 19 age group. I think it can be super beneficial to have someone who is younger in age being the one who's doing the interviewing with them. I know for a different project that I was involved in, that was kind of the age group we were looking at. And they actually brought me on solely to do the interviews for onboarding for these people, just because I think I was the only person under 40 who was part of this project at that point. And they were like, we don't know what the youth are saying these days. So I think kind of, going about it in that way can be really helpful. and making sure that they know that you are kind of there as a point of contact if you're entering a larger group setting. So if they have any questions, they can always reach out to you. I don't think that anyone's ever come across as pushy, but making sure that you set your guidelines as terms of like what you were looking for with this person, what kind of time commitment that you would be expecting, and making sure that they understand what it is that they're committing to before they get into it. I don't know if anyone else has anything else they want to add.
I was just gonna say if anyone has anything else they want to share.
Ken seems to have a question and has his hand up right now.
Oh,
Yeah,
sorry, Kent.
that's okay. No, I was just waiting to see if anybody else had anything to add to the previous question. Hello, multiple familiar faces. Thank you so much for being with us, and especially for sharing your time in the Eastern Time evening. My question, especially to those of you who had particularly flattering things to say about your time at and experiences with Child Bright, is if you had any constructive criticisms to offer to the Child Bright team, what would they be?
I can also start this one.
Okay.
I think that kind of what I just ended my last point on, where it's about being very clear about the time commitment of what you're expecting from the people who you're involved with and exactly what kind of partnership you're looking for. I do think that Child Bright has gotten better at doing this in terms of, on an engagement flow sheet, where how much engagement do you actually want out of this person? Do you want them to be a true partner in which they will be receiving emails for every single little thing that happens on the project? Or is it someone that you're more so going to for a consultation? And if there is a consultation happening, exactly how many hours are we talking about? I think that in any sort of research world, it's easy to kind of blur those lines about personal time constraints, but even it's very hard as a person who seemingly has less power at the table as a youth advocate or advisor to say, hey, this is a little bit too much for me. I have other commitments going on. So I think making sure that you're very clear about that. And that's one of the things that Child Bright, I think they're learning, but has not always been great at.
I think you're right, Claire, like they are learning how to do that, and I think certain programs within the network do that better than others, and I can say that about mostly everything that Child Bright struggles with. But I would have to say that whenever it involves people with lived experience, whether that be parents and caregivers or youth like ourselves, I think Child Bright really does put their best foot forward in terms of trying to engage us in the best way possible and in the way that is the most authentic. The one thing I will say is that sometimes there's some miscommunication between the programs within the network, and I think that is something that the network as a whole can work on in terms of inter program communication and how the programs work together and how they work with people with lived experience and not to duplicate any of the work that they've been doing. And yeah.
Yeah, I kind of already echo what Clara and Logan has mentioned. I think that Child Bright definitely kind of made really mass improvements and really kind of has really kind of thought really long and hard about this. I think Claire, what you mentioned about kind of having those really clear guidelines, I think is really kind of helpful, just because it helps the youth partner or the partner in general just really kind of understand what their role is. Sometimes when youth are engaged in different projects or research, it's they might kind of feel maybe they're only being used just for their lived experience, and it's the researcher kind of just checks off yep, I consulted with someone with lived experience, and then the youth partner or partner in general is just kind of sitting going, a little bit more than just my lived experience, right? So I think kind of having those guidelines kind of really helps. And also I think really kind of understanding, like as you mentioned, like what the engagement level is, and especially kind of when a lot of these engagements are happening essentially like over Zoom or over email, like it kind of gets a little bit difficult, especially with time zones being a factor. So kind of like having kind of those like clear schedules of like what's expected, and also like knowing like how the the partner can be supportive. I think that's like another kind of factor that's really important, because like it's not just that that partner might be in school or also have their own job or career, so kind of managing that is some other kind of important factors, and just kind of those overall kind of opportunities of how best to engage.
I think you've all raised really important points. I do think it's also important, asking the youth how they would like to be involved, right? I think that's another essential, sometimes youth are more comfortable doing certain tasks over other tasks, or even perhaps introducing like the involvement matrix, to make sure the lines don't get blurred and, just for more transparency. But we do have a question from Linda in the chat. She asks, reflecting back on your experiences, what would be your advice to youth partners who are new to engagement?
I think my advice would be to really lean on the person that brought you into the space. And if you were the person that was reaching out for those opportunities, make sure that you communicate effectively with the PI or the research lead about how things are going, and also I put the onus on the researcher to have frequent check-ins with that youth, especially if it's their first time. And just to know that like it's okay to not be good at it the first time around, and we're all learning, and I think in that situation the researcher is also learning from you as an individual, and I think that's important to remember, that you're not the only person that is experiencing something new in this relationship.
Yeah, very well said, Logan. I agree. I think a lot of the times people tend to forget it's a reciprocal learning journey, right? We each learn from each other, and especially if it's new, I think it's important to recognize that, we're all in this together and it's not one person should have more power over the other, which is a good segue into Corinne's question. She asks, for those of you who have mentioned having experienced power imbalances, what would you advise to other youth who are experiencing this as well, but have yet to address this on the project team or committee group?
I think if I can go first, um, to say that, like, to just recognize that you as the youth, and you as the person with less power at the table, um, that's a very natural feeling to have, and a very common experience. And I would say that once you're comfortable with the team, um, you know, you might not want to bring it up like in a group setting, because that might be too intimidating, but like maybe, maybe you've developed a relationship with the project lead, or someone else on the team that you can confide in, and let them know that that's what you're experiencing, and maybe they can help you bring that up to the larger team, and or have like a one-on-one conversation um with somebody that you trust to talk about those issues and how to resolve them.
Yeah, I kind of like agree with what Logan said. I like, obviously I think it's it's as Logan mentioned, like it's natural to feel a bit nervous. Like yes, like it's obviously bringing up kind of concerns about a project. Is definitely kind of something very nerve wracking, right? Especially because they have kind of this. They might have like a fancy title, and maybe you don't necessarily have a fancy title yet. So there's obviously that worry, but I think also, and obviously it's kind of easier said than done, but I think it's also important to remember like one's lived experience is so kind of valuable. Like it's really important. It's really critical to the project, right? Because it's gonna have like it can have like a really positive influence on that project. So it's important to kind of bring it up, right? Because if the project is going down like a path saying that might be, for lack of a better term, incorrect, then yeah, you have to kind of bring it up. But the way kind of Logan, I think, mentioned is maybe asking one or two people, putting one or two people aside and ask them. I think maybe that's like a really kind of great option because like in the group setting, there's might be kind of group dynamics at play. But if you can pull somebody aside and go, hey, like, look, I'm not feeling the best about this project, this is how it's making me feel. How best can I utilize like my time and my experience, then that kind of can really kind of go a long way. So, yeah.
I'd like to bring up the fact that they're also very understanding and adaptive to your needs and your own experiences, and the fact that they also tend to want to work with you, having lived and living experiences. So as much as you might not have a lot of power, they, in a way, you somewhat do, as you would have the insight and with your lived and living experiences that they would want to learn more about or do research on. And so in some way we do have some power, as we have our own choice on whether we want to work with them on giving them their insights on our lived and living experiences with our disabilities.
Thanks, Jacob and Matthias. I almost wonder, Matthias, when you bring up, pulling someone to the side and saying, "Hey, like I don't feel comfortable," rather than engaging with the large group. I almost wonder. It makes me think whether, research teams should have like a member mediator, perhaps that is on the younger side, especially for youth, right? So to have someone in similar age range where, the comfort might be there a little bit more. But I'll pass it over to Celia.
Yeah, this has been really great. Thank you. A couple of you mentioned that you've been involved in qualitative interviews, and I'm just curious about your experience with that. How did you like? What training did you receive? How did it go? um, uh, it's always interesting to hear how people kind of get introduced to qualitative work.
I can probably start like the project that I was a part of, like where it was a qualitative study. Essentially, we would have like regular meetings, right? So kind of leading up to that, they kind of we were presented with the interview questions that we were going to be asking, and we kind of had a group meeting, kind of like on how that was going to happen and what's kind of involved with that. Because I've had already like some previous experiences with presenting, like I felt a little bit more comfortable kind of going into the interviewing of the participants. So when the day kind of came where we had the opportunity to interview one of the participants, like we kind of split up. Okay, like one person's going to be asking the questions, the other person's going to be taking the notes, right? And we split it up like that, and then we switched roles essentially. But then essentially, like the questions were already developed by the lead researcher, so that kind of made like our job as a patient partner a lot easier. So we were just kind of like asking the questions. But essentially, I guess the difficult part was, or the challenging part was how to like ask like I guess follow-up questions, right, to elicit more information from the participant. So I think kind of the benefit of actually essentially having that shared experience with a disability can really kind of help create like a comfortable environment, which allowed for the participant to kind of share their information. And I should probably preface it by saying like that's kind of my own experience with doing the interviews and the qualitative and study. It might be different for somebody else.
Totally. I would say that my experiences in similar situations have been, like Matthew said, it can be very helpful to have had your own lived experiences when you're approaching those questions and kind of how to phrase them towards other people who might have been through similar situations. Um, and I know recently one of the projects I actually was a part of that's through Child Bright, one of the researchers there at one point was like, "Can I say something?" She's like, "I relate to this so much." I'm like, okay, perfect. I feel like it makes you feel way more comfortable as a participant and specifically like as a youth involved in it when the researchers kind of seems to have similar experiences to you. So that part can be super encouraging. And then I think also just from, one of the things that I was involved in with the Child Bright, I did a stakeholder dialogue, and part of that was creating like these little patient vignettes of like a mock patient and having conversations around kind of how we thought that patient would go through, specifically transition from pediatric to adult care, which is what my project was on. Um, and following that pathway of, having been a patient that had gone through that transition process, I think it made that a lot easier for me. But it was my first time ever doing like truly qualitative research coming from like a science degree and then medical school. I think there's a lot of like hard numbers and quantitative and what is the little organelle going to do in the cell and all of that. So it was definitely a big learning curve for me.
Yeah, for me, I can kind of echo Claire. My experiences come from, my master's when I did my master's thesis on looking at fathers' emotions on raising children with cerebral palsy. For me, I think bringing in my lived experience brought forth probably more trust with the fathers, like, hey, I'm in kind of intruding in your personal life, can you tell me about your kid? And I think bringing forth my lived experience to help ensure that vulnerability and being able to open up more. So just, creating a safer space. But I know that's not something every researcher has the opportunity to do. Yes,
And,
Celia? Oh, sorry, Jacob.
and, and for me, it's similar. I do a lot of this work for the fact that I had lots of struggles when it came to learning. Um, learning to, as most of my disabilities tend to be learning disabilities, not to mention all of my disabilities except for my hearing loss. I was diagnosed with them late, and so I never, I had, I didn't really get any help services until it was way too late, where it didn't have much of an effect. So, um, having that unique experience where it was not caught early enough, I have a unique perspective of how it affects people who are diagnosed late in these disabilities, especially when they have more than one and such, which tends to be a bit of a valuable effort that researchers would like to have, as they don't come across near as many people like this, as most don't uh, go through the efforts like myself here to try to get changes done to hopefully prevent this from happening in the future.
And my experiences um with conducting qualitative interviews actually starts um very interestingly because I was outside of Childbright, I was asked to um develop the interview guide for a research project, but also participate in mock interviews. Um, so that the researcher could ask me the questions and see if they were relatable to youth. And then eventually I was asked to be the interviewer of those questions. So I was able to not only share my lived experience, but share my direct experience with how those questions felt and how those questions were perceived by someone that was of similar age to me and of similar lived experience. And I think that one experience I brought into my current work um, when I work with my partners on my current team, my youth and child partners, and I just I try to remind them that I was once like them, and then that they can get to where I am, in terms of becoming a researcher themselves and talking about their lived experience for a living. Um, and if they want to do that, I'm here to support them.
Not to mention, most times when we're talking about our disabilities, we might not have we might not experience all of the symptoms of our disabilities, but we often still have relatively good knowledge on these other symptoms of our disabilities that we might not have. So we also do our best to give insight to how these other symptoms that we might not have within our disabilities might affect others, so that we're not solely keeping it to only us. We're hopefully adding facts about other parts of our disabilities that we might not have in order to create change and then more knowledge on our disabilities as well.
Thanks, Jacob. So we're close to time, but we'll take one more question from Celia.
Yeah, and thanks for the last response. It's always interesting to hear people's experiences. My next question is kind of on the other side of things about policy. And a few of you mentioned some of the policy changes and advocacy work that you've been involved with. So just curious to hear a little bit more about your experience on some of the policy change work.
I think I can take that one. The project I did through my child right was the stakeholder dialogue, and that was specifically about looking at what policies exist across Canada right now around age of transition, and is that a firm number in some places, or is that something that is kind of approached as a like soft boundary, and specifically how that number and how biological age and chronological age may not line up, and how they were handling that in different centers around the country. I think from like a policy change perspective, trying to get decision makers at a table can be very difficult. And specifically, as a youth researcher, trying to get credibility among policymakers can be very, very difficult. Outside of my work with Childbright, I also was the co-chair of an Ontario health team based out of Ottawa, pediatric health team. So I had a lot of work specifically with the Ministry of Health in Ontario, and had previously worked as a patient advisor for the Ministry of Health. So I think that my policy perspective is like a little bit different, but trying to do research on it was a whole new world. I think there aren't as many, at least from my understanding, scientific research. There are such like clear guidelines on what to follow, what to do, and there really is a best practice on how to go about making change. But when it comes to making policy change, there isn't that. A lot of it is like, who do you know? Who can you get this in front of? And I think like this constant fear that you're just going to produce a report that gets put on a back burner and who knows whatever happens to it, which is definitely a risk with anything policy related. But I think that it's about kind of trying to network and make those connections is the biggest piece of advice I have for researchers who are looking to do that. You never really know who like the right person to talk to is. And I think that my work through Kids Come First, which is that Ontario health team I was talking about, really taught me that. My co-chair is now the president of the CMA, or the CEO of the CMA of the Canadian Medical Association. And he is a huge politician at heart, which is super, super helpful. But a lot of it is like fake it till you make it confidence, and like walking in and like getting a meeting with someone and being like, this is what I want to change. And then, I think that there's often, this is going to sound bad, but a bit of buy-in that you can get as a patient advocate or someone with lived experience. And it's on you to leverage that for your benefit. It's hard to be like, no, I won't take this meeting with, a youth partner who's trying to put forward her research or something like that. So use that to your benefit and be like, please. I don't know if that really answered your question, Celia, but I think it's mostly about like networking and trying to like weasel your way into the right room.
I don't have as much experience when it comes to policy changes or work, but similar to Claire, I've done quite a bit of work with the health, Keiko, the health minister, if I recall that correctly. And even though we might not be able to cause change, the fact that we're speaking out in regards to it just adds to the fact of what us and others with our disabilities are facing. And so the fact that we're speaking out on this could help create change eventually in the future. And so, for example, we might be speaking out about something, but if they have a lot of others who are speaking out similarly about this who agree, that might result in a change later on down the line for us to have that a change done to help us out. So, for example, for those who are more physically disabled, getting more elevators installed for more public areas, for example, or really any other type of change like that for anyone else. But it really depends. It's not guaranteed to happen, but at least putting the word out so that there's a chance of something happening eventually in the future.
Thanks, Jacob and Claire. Well, we're almost at time, so I'll just highlight a few key takeaways. I think one of the biggest takeaways we can take from this webinar is that, we all start somewhere. I think it's important, youth deserve a chance. And as Claire mentioned, usually, it's about finding the right person or just trying to step through the right door. But, for researchers to also recognize that, it's a learning curve, it's mutual learning, it should be mutual. It shouldn't be a power dynamic issue. I just want to thank you all for joining us tonight, and thank you to our amazing panelists, and hope you have a good evening.